Okay, what I'm going to do, I'm going to share my experience of trying to access a hysterectomy on the NHS, um, a local hysterectomy with a regular gynaecologist. Okay, so I was referred well over 2 years ago by the Gender Identity Clinic where I was at Charing Cross. Yeah, well over 2 years ago. My GP then referred me to a local gynae that they use, where I went to see him initially. And because I'll just show you, I had a hernia operation here quite a long time ago. Oh, over 10 years ago, well over 10 years ago. He thought that he couldn't go in here and there might have been mesh, which would mean that I'd have repeated hernias, and that's something that obviously I wouldn't want. I didn't say anything, but I just agreed with him. Whatever, he was going to write to UCL, which is hospital in London, to check whether they'd used a gauze or something. Anyway, so I went back to him 4 months after that, and he said he hadn't received no letter, so I had to go away again. Then I went back again, and no letter still. And I didn't see him. I saw another guy who said that he would then send off for another letter, which he did. And then I went back and I saw his registrar, who said, this has been far too long, I'm going to put you on his list, which was not this October gone, it's now December, not this October gone, but the one before. I'm going to put you on his list for hysterectomy, and so I was quite delighted with that. But then I received a letter from him saying that he'd taken me off his list and would make an appointment to see me within the next few weeks. That was last October and nothing happened at all. So this August, which was nearly a year since he said that, I went back to the GP. My GP, what I did at my practice, I chose a GP to go and see a GP who specialises, that's her area of speciality, the gynecological stuff, and I said to her that it's been over a year and I still didn't hear anything, and she said that she didn't think that he would be discriminating, but that she would send me a referral to him again. So I said as long as she felt that he would do my surgery, then yeah, cool. But when I went to see him, he said he was waiting for a letter, and I thought, I just kind of got really frustrated inside, and I said, what letter? And he said, from the gender clinic. And I thought, this is ridiculous. I said, look in the file, and I looked in the file with him, and there was the letter from the gender clinic already there. And I just felt like he was trying to fob me off constantly. And oh yeah, one thing I did mention, that he said that if he couldn't go in to do a laparoscopic, that the psychiatrist would recommend a scar going this way rather than that way, because then it's not a female looking kind of thing. And he said he couldn't do that because it would take too long for the muscles to heal. So everything, he was just putting obstacles in the way constantly, hurdles in the way to me accessing a very routine surgical procedure. And at this stage now, I've been having pains for at least 8 months, intermittently, and lower pains, and they've become quite uncomfortable. There'd be at least 2 days I couldn't really do anything at all, and I was constantly on painkillers for about 4 days, which I don't like to do myself. I don't like, taking tablets for pain relief, but it was really essential because it was that intense, and I was not very comfortable with that. So he then come clean in the consultation and said, actually, me and my boss have had a meeting about you, which made me feel very different and not the same as, and really kind of like an object of confusion. And he said that he wouldn't. He said, well, he didn't really say he wouldn't do the operation, but he said my boss will give you the your operation?" And I said, "Do you know what? I'll be honest with you. I don't want either of you doing my operation now. I'm going to get a referral to someone that wants to do my surgery." And so I left there. He said, "Let me know the name of the surgeon, the specialist, or whatever that will do you, and then I'll get my secretary to refer you." Anyway, what I did then, I put it out on social media, and a friend of mine contacted me privately and said that she sees a gynecologist, female gynecologist, quite local to me, who's a really nice woman, and she highly recommends her. So I've done a bit of researching, so I didn't want to have a repeat experience of what I'd been through, because it really impacted on my well-being, really, because it made me feel different, and then it impacted on my gender dysphoria and made me feel I don't know, kind of like a nuisance and a pain, and you know, not normal, not the same as everyone else, and that I needed something different. And this guy didn't, like me and all this stuff, and that's not something you expect from a health service. Anyway, and I was very patient with him. I didn't lose my rag at all in all them times I'd seen him, apart from the last time I got a bit agitated by then, which is understandable, I think. Justifiable, really. So anyway, I went to I'd done some research on the woman. She's called Miss Al Farah, and she works at a private hospital in Sawbridgeworth called the Rivers. She also works at an NHS hospital in Harlow, which is just over the border in Essex from me in Hertfordshire, and as Princess Alexandra. So I went to see her, and she, what a different experience. She told me exactly what she'd be doing. She told me she would take my ovaries, the tubes, the womb and the cervix away. She would do it laparoscopically. I said, well, maybe there's a problem with my hernia thing. She said no, she would go through this part of the belly button, which wouldn't interfere with this here anyway, and give me 4 incisions here. If she couldn't do that, she would give me a scar that goes down like that, whichever side they access, I don't know, there. And so I wouldn't have the female looking one. I didn't say that, she just said that. And she also said that I'll be in a male ward. Even though the wards are mixed, I'll be in the male part of the ward. And are there any questions? And there wasn't any questions. I felt really accepted and really normal. And I thanked her for that. And her and her secretary together really helped me from October the 30th or something to now, which is December the 7th. I've been able to find her, write to her secretary, get a referral from the old surgeon's secretary to the new surgeon, and see her and be put on her list for surgery within that time, which is incredible for me, because that's restored my faith in the NHS, so that, there are people that really do care and really don't care about your gender or the fact that you are a man that has a cervix and a womb, and you want a routine surgical procedure, but your gender is, it's not so common to see a man having a hysterectomy. So yeah, it's really, really good for me to know that now I'm in the hands of someone safe. And our hands are a lot smaller than the guys with massive hands, so it wasn't meant to be, was it? Maybe something was going to go wrong anyway. So it's all good. I'm glad. So I'll put another video up of how that feels, not to how it feels anyway.